This is an important lecture and follows actually a previous one that I will give about opioid-free anesthesia, where we will show the importance of avoiding the opioids and improving the outcome. But besides that, there's a lot more that we can do, particularly in our laparoscopic procedures, to improve the outcome. The ERAS principles are all well known, and this applies to what we have to do preoperative, what we have to do perioperative, and what we have to do postoperative. These principles were first started in colorectal surgery, but for morbidly obese patients, these most of them will apply too, but need some adaptation. And it's about these adaptations, these specific requirements for the morbidly obese patients we will talk on this lecture. So we will not just talk on the opioid-free as one possibility, but on many other aspects that you have to do. And just to show you one example is the beach chair position. Something is so important in morbidly obese patients to have your patient almost never laying flat, pre, per, and postoperative, because in a morbidly obese patient we have to think about keeping the lungs open and having your patient without any atelectasis and having sufficient force to breathe. And that's one item. Another item on enhanced recovery after surgery is to preventing the inflammation and the edema. It is something you should start with the start of your anesthesia induction in avoiding fluid overload. It doesn't mean that your patient should be hypovolemic, but most of the time we have been giving in the past too much fluids just to have a hemodynamic stability, and in this regard creating edema and having a higher inflammation, more postoperative pain, and a slower recovery. So if you want to improve the recovery and the outcome, well, that's another aspect, but there are many other items, and if you want to hear about this, go and come and discuss together in this lecture what we should do to enhance the recovery after surgery.